Criterion's EHR has a health maintenance engine. And what this health maintenance allows you to do is create various rules regarding conditions that will prompt alerts for either staff members to contact patients, for doctors to be aware of upcoming uh, requirements for their patients, or for the patient to be contacted via the portal. What these rules do is it allows you to create a specific set of criteria where I can say the patient needs to come in for a glucose test. And what we're going to do is we're going to order the glucose test for all patients who have a diagnosis of, and we can pick something, we'll pick hypertension in this case, who are male, over the age of 60, and on Lipitor. So I can set as many or as few criteria to generate this rule. I can say that the duration I want this performed, I want this done every 6 months, and I want to notify which users in my practice that this alert is due. And you can select one or multiple different users. And we want to send the notification to our users 1 month prior to when it's due. Creating a rule like this will run a process that looks at all of your patients and will find anyone who matches this criteria. If they don't have a glucose test that's been done within that time frame, it will generate the alert that this patient is due for that if they meet this other criteria. Now, within a patient's chart, you'll have the option to have a health maintenance notifications panel that will show you any of the tests, procedures, immunizations, things that this patient is due for, what the due date was, and what the status is. You can then manage these by actually ordering the item, by administering the immunization, adding all that information in. Now, these notifications can go to separate reports, and they can go to other users' dashboards so that when the user logs in, they'll see a list of the notifications that are outstanding. They can contact your stat or your patients on those lists and notify them to schedule appointments for this. Within a patient's visit, when you are accessing the plan, the system can show you any alerts that are due for that diagnosis for the patient. So based on a patient who's coming in with high blood pressure, it's going to notify me that this patient is due for a glucose test, and I can order that directly from here. The reports section of the EHR also allows you to go in and run separate reports based on the different rules, where you can say I want to find all of my patients who meet this criteria, and you can select date ranges as far as you want to see all the patients who are due within the next month for this particular rule. You can select to search by patients, so there's a number of different criteria you can use.